Welcome to this video interview with the investigators of the THAWS trial. So with me here I have Professor Koga and Professor Inoue from Osaka in Japan. Thank you for a great presentation yesterday.
Thank you.
So we know the results, very exciting. Can you tell us a few words about the kind of patients that went into the THAWS trial, please?
So we enrolled a relatively advanced aged patient. Mean age was 75 and NI stroke scale was 7 in median. And 70% had the wake-up stroke and 40% had any vessel occlusion. And last nowhere to randomization time was about 10 hours.
Thank you. And can you compare your patients to the patients that went into the wake-up trial last year?
Okay. Wake Up had the aged 65 around, so our subject could be 10 years older, and stroke severity could be similar, just 1 point higher than Wake Up, and similar last known to treatment or randomization time, and vessel occlusion. Actually, we didn't show the large vessel occlusion. Any vessel occlusion, including the branch occlusion as well. So could be similar percentage or less large vessel occlusion, we believe.
Thank you. So in essence, the patients were quite similar to the wake-up patients presented last year.
Yes.
Great. We've seen the presentation, but could you please shortly repeat the main result of the trial?
Okay. We believe we managed to show the acceptable safety profile of alteplase for wake-up stroke patient, but we couldn't show the difference in favorable outcome between RTPA and the control groups.
Right. I noticed you had a very low risk of ICH in the trial.
Yes.
And that's perhaps because of the lower dose of alteplase?
Could be, but also the patient selection based on the FLIR imaging was very important, we believe.
Yes. I noticed that also many patients in the control group were given antiplatelet or anticoagulant treatments.
That's right.
Was there any that is routine in Japan to give such early treatment with heparin and argatroban and other antithrombotic drugs in the acute phase?
I see. Because of the open label trial, we compared alteplase and standard medical treatment. In Japan, more than 20 years ago, we had a clinical trial for argatroban and the guidelines saying recommending the use of argatroban for thrombotic, such as atherothrombotic brain infarction. So we use argatroban for non-cardioembolic stroke often. Okay. But
thank you. What is the reason you think why the trial was neutral while Wake Up was positive?
That's a very important point. Because of the small number of patients and prematurely terminated trial, it's difficult to conclude, and giving the difference could be due to the early initiation of antithrombotics, could be the by chance, could be the difference dose. So, but we couldn't conclude for the difference anyway.
So what will you say in retrospect? Mm-hmm. Were you happy that the trial was prematurely finished, or would you now preferred to have continued the trial until the target sample size?
That's an important point, because of it's always, but funding is limited, and we contacting with the Wake Up group and extend group, so they decided to terminated, and we planning to patient level individual meta-analysis soon. So we decided to terminate this trial this time.
Yeah.
Yes.
So, what do you think? Is there still room for research in this area? Is there still need for more trials in these kind of patients, or do you think that there is a definitive answer to this question?
So Manabu gonna ask this question.
Oh, okay. Yes, we definitely think there's a room for it. And for instance, we only had a small number of patients. In collaboration with other similar trials, will expand the numbers. And of course, that will really magnify the impact of this whole trial, the concept of this trial. But in future, we might think of another TPA, such as tenecteplase. That might be another option for all these wake-up trials as well.
Thank you very much. Thank you very much for your interpretation and presentation again of the results to you, Dr. Koga and Dr. Inoue. So with this, I say thank you for this interview and thank you very much.
Thank you.
Thank you.